Okay, so pregnant moms, quarter to deliver moms, first of all, congratulations on your bundle of joy. But come here, let me share a few things with you that you're likely to experience right after delivery. This is going to be the CS edition. Hi, my name is Sandra, and I share a lot of content around motherhood. So if you haven't already, please follow this page. And before I start, please, this is not medical advice, this is not professional advice. This is just advice of my own experience. The people that follow this page know that everything I talk about is based off of my experience and the experiences of other mothers that I have met in the course of my content creation journey. Now, the very first thing, if you're going to be having a cesarean section or even a vaginal delivery, because I did read up on this point, the very first thing is that right on that operating table, immediately they bring out your baby from you, just give it say 30 minutes, you will start to shake. It's called the shake. I don't know the medical term for it, like jitters, literally like teeth clattering. You like you will really be cold. Do not be afraid. That is normal. Because when it happened to me right on the operating table, I thought that they had done something to me, like, oh, I was dying, and I kept saying, doctor, I'm shaking, I'm shaking, I'm shivering. And the doctor said, oh, don't worry, you're fine, it's cool, it's going to go. So that shake lasts for about 30 minutes to 2 hours, like real cold. Even blanket is not going to help you, like you literally be shaking. I read up on it and they said, oh, like it's a hormonal thing, your body after being pregnant for so long and now it's no longer pregnant, so there is that change in hormonal balance that makes you to shiver. So when you experience this, do not be afraid, it is normal. The second thing, right after your cesarean section, when you are healing, the very first step that you are going to take is going to be the most difficult step ever. But you have to take that step, you have to get active. Now, when I say get active, I'm not saying immediately after your cesarean go and cook pounded yam for your husband. No, I'm not saying that. I'm saying learn to move from here to there. Don't be in bed all day, don't be a bed body. Get up, move around, stay with everybody else in the parlor. All of these things is going to help your blood flow, which will in turn help your delivery. It's going to make your delivery really rapid. So please don't be in bed all the time. That step is very difficult. It will feel like your intestines are literally falling out of your stomach, but you have to endure, persevere, and take that step. It's going to be really, really painful, I must tell you that. Now, the next thing, laughing, coughing, sneezing will be very difficult. Like you will not be able to even laugh. If you try to laugh, all your stomach will look like your stomach is contracted, like it's so painful. So you can imagine, like your incision site is still very, very fresh. So if you try to laugh, you're like and you know the funny thing, that period, that is when everything around you will be so funny. So you're going to experience that a lot of pain when you try to laugh, when you try to sneeze, when you try to cough, anything at all, you're going to feel so much pain. So what helps me is that I will just put a pillow there and just try to or laugh a little, like so that there is that pain. In that same vein of pain again, you will not be able to shit though, like you will not be able to poop for a very long while. I know that my own not being able to poop lasted for about 6 weeks. It's not like you won't be able to poop, but you're going to be so constipated and the pain is so much. I literally used to cry from the toilet. Like when I'm trying to poop, I'm like, I'm literally crying and the poop is not even coming out. So some mothers said that they took laxatives like maybe Andrew liver salt or poop softeners. I did not know that update on time. If I had known, I probably would have taken it. So I did not hear this update. I was literally struggling to poop. But please, before you take laxatives, ask your gynecologist, ask your doctor that it is safe for you to take and also for your baby to take, because you'll be breastfeeding. Another thing too that will be very difficult then is breastfeeding. So now this is like two levels of pain, because even if you gave birth vaginally, breastfeeding for the very first 2, 3, 4, 5 days is very painful. Then add that breastfeeding pain with your incision pain. So what you can do for that is to get a good support pillow. For some people breastfeeding pillow works for them. For me, breastfeeding pillow did not work. What I did was just stack my pillows up or until it got to my boobs, and then I put my baby on it. That helped me. But if breastfeeding pillow is going to work for you, you should invest in a really good one, and it is going to really help you. Also, if you gave birth through a cesarean section, you are likely to be having bouts of headache just throughout the day. Like you just stay and then one big migraine, one big headache will just headache you. And they said that it has to do with the epidural that we get, when we put to bed via CS. I don't know if the people that give birth vaginally also experience this. I can only speak on what I have experienced, which is a cesarean section. And then another thing that's going to really really help you is to get loose clothing. You can get nightgown, just regular nightgown, this aboma maka nightgown. It will really help you then, because that period you don't even want anything touching your skin, like you just want your body to just be like that. Loose clothing and very good support nursing bra is going to really really help you. Try to avoid two-piece clothing, because the waist side, that band is going to be very 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 uncomfortable for you. If you can get just one piece, like just this throw on night wear, that would really help you as well. So these are the things that I can remember for now. Please, if you're a mother in the comment section and you gave birth through either cesarean section or vaginally, please comment down below in the comment section the things that you experienced that you want other moms to learn about. And if you watched up to this point, we're now best friends, so you know what to do. Follow this page. Thank you very much for watching, and see you in my next one. Bye.